but more cytoplasm and eccentric nucleus. Nucleus large clump periphery located. Adjacent to nucleus is the Golgi apparatus, rare in connective tissues, secretes immunoglobulin antibodies. Cytoplasm have acetophilic granules known as Russell bodies. And then there are others.
Also, he emphasized this in class. I don't remember the specific parts, but he said if it looks like crescent shape, then you'll be able to figure out that, okay, it's plasma cell.
He was saying that the light blue part is made up of Golgi bodies.
And so then we'll go into other cells. So we have lymphocytes. They're spherical nucleus, sometimes flattened on one side, and has densely heterochromatic, and then pale basophilic cytoplasm with azurophilic granules.
What does that mean?
I don't know.
Okay. I'll look it up. Continue.
And then it has T and B lymphocytes, not phagocytosis, but helps inactivate the foreign substance. And there's basophils. It has 3 lobes, and it looks like an S shape. Its nucleus.
He was saying that there are 3 lobes you can't see because of it's covered by something.
It has limited movement and phagocyte capability, found at the site of inflammation and hypersensitivity. Large basophilic cytoplasmic granules, irregular shape. Granules contain heparin and histamine, releases a response to antigenic stimulus, homogeneous, electron-dense granules. Sorry guys, I'm just reading.
You're fine.
Okay, and then we have eosinophils. They're bilobe nucleus with condensed chromatin. Small size in blood, which is 9 nanometers. Large in CT, 14 nanometers. Phagocyte with reference to AG and AB complex. I'm not sure what the AG-AB complex is. Increase in numbers with allergies and parasitic infections.
Go.
I love you, Em.
Go home.
So, eosinophilic cytoplasmic granules, specialized lysosome that contain electron-dense crystalloids.
So you can differentiate because it's like 2 nuclei, bilobed. So then the other one is, you can't see the nucleus in the basophil?
Yeah.
Okay.
It has like 3 lobes.
But it looks like there's like a lot of lobes. So maybe that's how you can tell. Okay.
And the eosinophils are also present in red blood cells as well as connective tissue, but in blood cells it's like super small compared to connective tissue.
This is a basophil versus
Eosinophil.
Oh, okay, so they're smaller in blood.
Yes.
Okay.
And then we have monocytes. They're kidney-shaped or horseshoe nucleus with less condensed chromatin. Only found in blood. When it leaves the blood, it doesn't come back. Cytoplasm contain numerous azurophilic granules.
Yeah, so that just means, I looked it up, it's a cellular object readily stainable if you're using a Romanowski stain. Basically, it just means that it's going to turn burgundy or Merlot coloration in white blood cells and the hyperchromatin.
Nice, thank you.
Yeah.
So kidney shaped is monocytes, bilobed is basophils, eosinophils.
Mhm.
Eosinophils is bilobed, and basophils is all over lobed.
S-shaped, I guess. I don't know. Nucleus, I don't know. But it's all over.
Yeah.
And then we have the neutrophils. So lobulate nucleus, 3 to 5, so it's highly condensed chromatin. Bar body, drumstick. Does it look like a bar? And hypersigmoid nucleus, band neutrophil insert. It's abundant in cytoplasm, specific granules, and then also the azerophilic granules, and contain more glycogen than other leukocytes. It's the first line of body defense for phagocytosis. So then we're going to go into the type of connective tissues. So there's connective tissue proper, which breaks up into dense connective tissue and loose connective tissue. And then dense can be either dense regular or dense irregular. And loose connective tissue can be reticular, adipose, elastic, or blood. And then we have the specialized connective tissue. And then I believe that can also be reticular, adipose, elastic, or blood. And then embryonic connective tissue is mucus and mesenchyme. And those are our loose connective tissue. More cells of different kind of fibers. Collagen fibers type 1, randomly scattered, and fewer reticular fibers, which is type 2 collagen. Moderately viscous brown substance. The function is to support blood vessels, nerves, and epithelia. Location, lamina propria, periosteum, perineum, and filling space between tissues. And then we have the dense connective. It's either regular or irregular. They're mature fibrocytes. Let's see. Almost all are type 1 collagen fibers. Some are elastic or reticular fibers. Irregular and irregular. Or smaller quantity of ground substance. The location is tendon, ligament, fascia, joint capsules, and dermis. The function is to bind bones and mechanical forces and protection. And then we have special CT reticular, which is type 3 collagen, form a delicate 3-dimensional network. Cells are suspended and prominent. Reticular cells are firmly attached to the fibers by the cytoplasm process. It has little ground substance, function in support of motile cells and filtration of body fluid, found in bone marrow, spleen, and lymph node. And then we have special connective tissue elastic. It's thick, wavy bundles of prominently elastic fibers in arteries, individual randomly organized fibers in the mesentery, red glassy appearance in lamina propria of the trachea stained with aldehyde fusin. And then we have embryonic CT, which is mucus and mesenchymal CT. So the mucus is cells with few, mesenchyme and fibroblasts, few collagens, elastic, reticular. Cells and fibers are random. Wharton's jelly of umbilical cord and pulp of developing teeth. And then mesenchymal CT, there's many of them, many mesenchyme, few type 1 and type 3, loose satellite cells and large intercellular space, and then throughout embryonic tissue. And so that's like a summary of all the tissues that we just went through. The chart. Okay, so then we have cartilage. Definition of cartilage is a form of connective tissue of cells called
Chondrocytes?
Chondrocytes, and intensive extracellular matrix composed of fiber and ground substance. Chondrocytes synthesize and secrete extracellular matrix, and cells are located in the matrix cavity called lacunae. Principal macromolecules present in matrix: collagen, hyaluronic acid, protoglycans, and glycoproteins. Elastic cartilage contain protein elastin in the matrix, and its function is it can bear mechanical stress without permanent distortion, support soft tissue, shock absorbing and sliding area for joints, and facilitate bone movement because it has smooth surface and is resilient. Essential for development and growth of long bones, both before and after birth. And so there are 3 types of cartilage: hyaline cartilage, elastic cartilage. Hyaline cartilage is type 2 collagen. Elastic cartilage is type 2 collagen also, and then fibrocartilage is cartilage is type 1 collagen. Okay.
So what makes them different types? Is there like certain characteristics for type 2, type 1, or? Well, you'll get to it. I don't know. Or I wasn't paying attention. I don't know. Like what? Sorry.
No, it's fine.
I was just
For type 1 is the
Oh.
skin, tendons, and ligaments, bone, teeth, and then... Okay, so basically type 2 is mostly auricular, and hyaline cartilage is in the eyes.
Okay, and then type.
Can you click images real quick?
Yeah.
So I think it might just be like the way it's formed,
Okay.
maybe.
Oh, no.
Maybe like the different types of branching.
Yeah. It's okay. I can look
I
at
guess it's just different types.
categories of like what it is. Yeah.
Just, yeah.
Okay, so all 3 forms of it, it's avascular and exhibit low metabolic activity, has no lymphatics or nerves. The pericardium is a sheath of connective tissue that surrounds cartilage in most abundant places, forming an interface between cartilage and tissue supported by cartilage. It has a vascular supply of nerves and lymphatics.
So it's a sheath, so usually
Yeah.
cartilage doesn't have blood vessels or anything.
But the pericardium has the vasculature,
Okay.
nerves, lymphatics.
And that's the sheath that surrounds the cartilage.
Okay. So I kind of like made a little chart, so I'd go through each one of it. So we do hyaline cartilage, so it's type 2 collagen, and the location of it where you find them are temporarily in skeleton in embryos, and then articular surface of movable joint walls such as nose, larynx, trachea, bronchi, ventral end of ribs, and epiphyseal plate. And their function is to synthesize collagen and other matrix molecules. and their component is